David Spunt reporting from the White House. David, thanks for that. Joining us now from Baltimore, Dr. Tom Inglesby, director of the Center for Health Security at Johns Hopkins University. Doctor, let's start with that New York Times report that from January on, top public health officials were warning the president about the threat from the pandemic and that he did not take action until mid-March. One, what's your reaction to the report, and how much did those lost weeks cost us?
So, Chris, I can't say who in the administration knew what and when, but I would say that that article reinforces what we've heard along the way, which is that many in the administration were very worried about this as early as January and February. That seems pretty clear now. And I'd also say that if we had acted on some of those warnings earlier, we would be in a much better position in terms of diagnostics and possibly masks and personal protective equipment and getting our hospitals ready. When you say be in a much better position, if we had imposed social distancing, stay at home at the end of January or in early February, would there be a dramatically smaller number of cases and deaths? Yeah, I'm not sure we would have been able to get the collective political will to do it as early as January or February because we didn't really know when we had cases. But if we had done a lot of diagnostic testing earlier, it's possible we would have seen enough disease to get the will to do that in February. And yes, the earlier we put in place social distancing, the earlier we would have gotten to a peak and to a better place than where we can start to think about responding. Let's talk about where we are right now. The U.S. now has more than 500,000 coronavirus cases, and this week we had 2,000 deaths in a single day. So we keep talking about that curve. Are we at the peak of that curve or even on the downslope, as some public health officials are now saying? It looks like in the last few days, if you look across the country and you average out the numbers, that we are near a plateau in the number of cases, which would be reaching a peak. And in some places like New York, which has had terrible disease, New York City, which has had terrible impact with this epidemic, we have had a few days of similar case counts day to day. And so that is what we might call a peak. It doesn't mean that the downslope of the peak is going to be fast. It could be that this plateau carries on for a while, and we've seen in other countries where they've started to have lower case counts over time that it can take days and weeks for the numbers to even get cut in half. So I think while we may be at a peak, we hope we are, it's still going to take time for us to start to bring the case numbers down, especially in places which are the biggest hotspots. Well, let's talk about that. There are all kinds of models we're talking about. First, there was a model that 100,000 to 200,000 people in the U.S. would die from the disease. Now the latest model is 60,000. One, how reliable are these models, and what's your projection for how many deaths we're likely to see from the coronavirus here in the U.S.? So all models are just approximations. They all have their strengths and limits, and so it's useful to look at many models and to try and get a general sense of things. I think the model you're referring to has been one that the White House has been using, which has had lowered estimates of the total number of people who might die from this, which is a model that really tries to fit the experience of Wuhan, China onto the United States as a whole. I think it's good for an overall general estimate of what might happen, but in terms of specific days when things will happen or specific numbers, I'm not confident in any particular model. I think it's hard to see out beyond a couple of weeks. And I think one of the biggest factors is that it will depend on what we do as a country. This isn't preordained what the final outcome will be in terms of overall numbers. It depends on our collective reaction, what we do with social distancing, whether or not we develop therapies over time that work, our overall ability to track cases and to build public health capacity around the country. That's going to be crucial for us to try and get control of this over time.
Well, let me pick up on that, Doctor, because the big question right now is whether President Trump is going to lift his stay-at-home guidelines on April 30th and begin urging leaders and businesses to reopen the country. Here's the president talking about that.
I'm going to have to make a decision, and I only hope to God that it's the right decision. But I would say without question, it's the biggest decision I've ever had to make.
The president says that he'll consult with public health experts, with business leaders. What's your recommendation?
I think it'll be too soon to reopen the country on May 1st. I think there may be parts of the country that have such good numbers and can build up such public health capacity and get diagnostic testing ability in place, some perhaps in May, but it seems like it may be May or June before the best places in the country, the most ready places in the country are likely to have all those things in place. I just think for perspective, it's important to know that the U.S. has more cases than any country in the world, and no country has reopened altogether in the way that I think is being considered. So even when we do start to ease social distancing, it'll need to be very careful, because if we're not careful when we ease social distancing, we'll recreate the conditions that existed back in early March. We could have another peak the way that we had one this month. So we're going to have to really be careful about it, think about keeping people at safe distances from each other whenever possible, wearing cloth masks, putting up physical barriers in workspaces if that's possible. We have to think about work differently. So I think it's going to be too soon, unfortunately, by the end of this month. The numbers aren't going to be anywhere close in many places in the country to do that for the whole country.
Let me pick up on that, because your Center for Health Security, the center that you had, is saying that before we open and then as we open, that there has to be much more testing. There has to be really a tremendous amount more, because there's very little right now of contact tracing. And then for people who still have the disease, that there has to be quarantining. The president was asked about more testing this week. Take a look.
We're going to see if we have it. Do you need it? No. Is it a nice thing to do? Yes. We're talking about 325 million people, and that's not going to happen.
Dr. Inglesby, the president says we've already conducted 2 million tests. How many more, when you talk about random testing, how many more tests are you talking about? And your center is also talking about the need for 100,000 more contact tracers?
So first, on diagnostic testing, we have done a lot of testing, but the ultimate number, the overall number, is less important than whether we have the ability to test anyone who has symptoms that might be COVID. Right now, we can't do that in most places in the country. There's just not enough capacity. We need to be able to have the capacity. So if someone says, I feel like I'm getting a flu or a pneumonia, they can walk into a clinic or a hospital or a testing center and get that test that day and get the results hopefully that day, so that they can be in isolation, that we can identify their contacts. So that number is going to differ from state to state depending on population and how they're organized, but it's going to need to be a lot more than it is now, because in many places in the country we can't get testing for mild or moderate cases. And in terms of tracking cases and contacts, that's the strategy that countries that have had most success have used to bring their numbers down. So for example, South Korea, New Zealand, Australia, Iceland, they're all using very, very active case finding and contact tracing and getting people in quarantine who are exposed to COVID cases. And using that strategy, they've been able to get their numbers way down. We don't have that capacity in the country, and so it's going to take a lot of people to get that built.
I got one big question left. I got a little bit more than a minute left for you to answer it. President Trump is saying that he may take action this week against the World Health Organization. And he and the head of the WHO, Dr. Tedros, have gotten in a real war of words over the past week. Take a look.
They called it wrong. They called it wrong. They missed the call.
If you don't want many more body bags, then you refrain from politicizing it.
I can't believe he's talking about politics when look at the relationship they have to China.
Has the WHO mishandled the crisis? Do they side with China? And what do you think of the idea that the president seems to be raising of cutting the U.S.'s contribution of $450 million a year to the WHO?
So the U.S. needs the World Health Organization to function properly. It is the organization that helps the world get prepared and respond to this. We're going to need the world to recover from COVID in order to get normalcy back around the world. We need the WHO. I don't think that they have been favoring one country over another. It's a really difficult situation, but overall, I think the U.S. should continue to do what it's been doing over time, which is work very closely with the World Health Organization and support its work.
Dr. Inglesby, thank you. Thanks for joining us today.